Treatment of the sciatic nerve.
Oh, eccoci qua. Allora, adesso trattiamo il nervo sciatico.
Okay, here we are. So, we're going to treat the sciatic nerve. Now, if you remember, we've done this, we've looked at these images already. We took the gluteal region, we divided it into 4 sections, and at the center we identified the exact spot of the genital system, which through our papier-roulette technique, we then drew a circle and we identified the exact spot. Now, at the center, therefore, we have the genital system, but now we're going to add another part of the drawing. So we need to find exactly where the sciatic nerve runs through and where it tends to become inflamed. To identify it, we need to take the top right quadrant and then subdivide this into 4. So here you have the right side of the top right side of the gluteal region. We highlight this quadrant, and right at the center, so for more accuracy, I'm going to draw another cross, and that I'm showing you here is the exact spot through which runs the sciatic nerve. Underneath that, we have the piriformis, which is a muscle. When this muscle becomes inflamed, it tends to swell and to compress the sciatic nerve. So first we find the genital system point, spot, then in the top right quadrant, we subdivide that into 4, and at the center we have the sciatic nerve. Okay, so before we actually work on this area, we will need to work on where it branches off. So on in the lumbar region, in the lumbar vertebrae to be exact. So I think this will clearly illustrate it all for you. So I've drawn the vertebrae in the blue rectangles. These are the lumbar vertebrae. And we have the sacrum, and then we have the coccyx. Now, for example, here the gluteal region is divided into 4. I drew a red spot in the center where we have the genital system reflex zone, and then I also indicated, I have referred to this as X, and this we have the, I called it the X point because this is where the person will tend to feel the most pain when the sciatic nerve becomes inflamed. So remember to work on this first, and then this pain will extend along and down along the thigh on the back side. Then it will turn around the knee and then runs along the tibia and all the way to the toes. So what we need to do here now with this technique is to unglue the skin and to alleviate the tension in the lumbar region. Now I'll show you how to do it, even if in fact you've already learned to do this when you started to work on the intestines metameres, both large and small intestine. You worked on the bladder and metamere, and you came very close to this point where the sciatic nerve runs to solve problems with the genital system. Someone to ask me, Francesco, what if there is a hernia underneath? Do I run the risk of causing damage? Well, now I'm going to show you exactly how the spinal cord is structured. Now, this is the position of my customer right now. As you can see, we have a spinal cord, and I will give you a brief description soon. And if you notice, we have a red swelling at the bottom of the lumbar region. So at the center of this picture, that is a hernia. And now I'm going to give you a blow-up of this image. Here. Okay, these are the vertebrae. I started from mid-back, so we're already close to the lumbar vertebrae. As you can see, we have the vertebrae, and then there are spaces, these are gummy spaces in between, which in this case they're made of silicon, but in reality they are the intervertebral discs. Now, at the bottom, you see this swelling. What is that? Well, it's a disc that has been so compressed by the upper and lower vertebrae that it has expanded, and as a consequence, caused this lump that will compress the nerves, which are shown in yellow on this model, which is the one that I use here in my studio. These wires are no longer there, but in fact, they're very long and they run all the way down the legs and supply the various organs. Now, this image here shows you the various intervertebral discs. And now, let's go back to this picture. Okay, so my customer is now lying in this position. And now we need to alleviate the lumbar region. We need to loosen the lumbar region all the way to the sacrum. So, as you can see, there is no risk whatsoever of touching the hernia because it lies underneath. We'll be working on the nerve supply on the upper part of the body. So, we need to go through the hernia, but by doing the palpebral in the top part of the body, we will alleviate considerably that area. So, and you have to know that this area is rich with nerves. So, if you use this technique that I've taught you in metameric massage, which is the ungluing of the skin, and it acts on all the adhesions that are formed, there is no risk of causing any damage at all. I'm convinced that now you will be more reassured and you will be more relaxed when you will be working on the person, even where that person may say that they have a hernia. So if you work with this technique, you won't have any problems. And obviously, though, you shouldn't improvise any techniques unless you're an osteopath or a chiropractor. Then you can do that. Otherwise, limit yourself to the palpebral technique and the results will be incredible. Okay, ready to start then? Now, first we need to use some oil. So even when I stretch the muscles, you see I work from the spinal cord in an outward movement, like an opening, in an opening fashion. So we do these openings, and then we will start with the palpebral technique, which is not pleasant as the opening movement, but then we have to unglue the skin from here to here. This is the lumbar region. And as you can see, one hand stands still, I leave it still, and the right hand is the one that does the palpebral, the ungluing. If you're left-handed, do the opposite. Now, to unglue the skin here, it may take from 2 to 15 minutes, even 20 minutes. Insist as much as you can until that person reaches that pain threshold. So as long as they accept it, it's fine. If they start to show pain, then alleviate the tension, alleviate the pressure. You see some skin here, it doesn't unglue so easily, but you do this work on the patient, and this will already improve the problem with the sciatic nerve. Now, we have to alleviate the muscle tension in this case that tends to connect one vertebrae to the other. So we need to dig in with our finger, starting from the spinal cord, so from the center, and move to the sides, both right and left. Through this technique, you have to almost dig in with your finger and create sort of rays that radiate from the center outwards, so for both sides. And then you will need to put pressure. You need to choose the line that runs through the vertebrae. You will notice, if you feel the body, that you will notice the points of the vertebrae. So you will have to put your thumb in between those points, and from the center, so from the spinal cord, you will move in and outwards. Don't worry, even if you don't hit the right spot, you're going to alleviate the tension anyway. Now here I'm showing you how I work from the center and I go down. See, I point my thumb, I press, and then I stretch the underlying muscle tissue. Then I do it again, but I move slightly up. So how many times do you have to do this? Well, about 100 times. Oh, no, I'm just joking. There isn't an exact number of times that you need to do this, as you be the judge of it. When you feel that the area is looser and that there is no more tension, then you can stop. So start from the bottom, start from the gluteal region, and then move up 1 or 2 centimeters at a time and repeat this movement. Now, I've done it almost all the way to the mid-back, and it's not, you can see it's not so painful. And then you move on to the other side. This alleviates the deep tissues that the person will feel almost looser afterwards. Again, as I was saying before, once you have finished one side, then you move to the other side and you repeat the entire exercise. You can't see it here because this is a close-up, but to do this massage, you need to stand on the side on which you are working. So I'm working on the right side of the customer here, and therefore I stand on the right side. And I sort of move my finger from the center towards me.
Pennarello alla mano e cerca di fare un disegno meglio del mio.
Okay, take your magic marker and draw this. Draw a cross on the gluteal region, and then you identify the top right quadrant, and you've thus identified the sciatic nerve. Now, once you've identified it, start massaging it. If you don't want the customer to get up and run, well, start gently. So use the right hand to massage, you press, and my left hand is almost accompanying that movement. You see, I'm trying to create a roll of skin. Obviously, I'm not doing that because the skin is very thick here, but here again I'm showing you the treatment in the lumbar region, and I slowly move closer to the sciatic nerve. I alleviate it, I loosen it until I eliminate the pain. The first 10 minutes are painful, but as you work on it, this pain will slowly, gradually decrease. You can see how this area here is turning red. So you have to focus on this spot. It's important to do that. If you work well on this, you'll get incredible results. It may be difficult in the beginning, just like in any other thing. In the beginning it's always difficult, but then you'll notice that it's a very simple technique to do. Now, notice how this part is turning red. You can see almost a spot. But you see, pinching the skin here when you have this large muscle tissue underneath is not simple. Okay, now before we go to the back of the leg, I wanted to show you this video where I show you how to work the genital system zone. Now, because the sciatic nerve runs very close to this, it won't hurt to work on the gluteus using this technique. So you loosen it up, and then you insist not only on the sciatic nerve zone and the exact spot of the genital reflex zone, you also work on the entire gluteus or gluteal region. So after this, after this part, we're going to work on the back side of the leg where this sciatic nerve runs. even though after the work you will have done on the lumbar region and on the sciatic nerve, you will have already done 90% of the work necessary to solve this problem. So what we're going to do in a minute, the backside of the leg is only an accompaniment to sort of like an icing on the cake, but the problem needs to be solved by working on the sciatic nerve point and the lumbar region.
Torniamo quindi dal nostro Big Gym e incominciamo a lavorare.
All right, now back to our big gym, and we start working the back side of the thigh. So I place my hands at the center of the thigh, and then I open up the muscle tissue. Careful with your thumbs not to press on the popliteal fossa, because it's the most delicate part of the leg. It's the back of the knee pit, to be sure. So now we start doing the palpé roulé throughout the thigh, especially on the external part, so on the side. But we're going to work on the whole part of the arm, because so we work from top to bottom. Now I'll show you this again, and I unglue the skin, as you can see. It will be enough to work on this for 5 minutes. I don't think more than that. I usually don't work more than 5 minutes because it's only an accompaniment to all the rest that we've already done. So this is not where you're going to solve the problem, but it is important to unglue the skin in this area as well.